Hi everyone, I'm Leigh-Anne Stafford, the Health Officer for the Oakland County Health Division, and this is a first for our weekly updates that the Health Division is going to continue to provide. I also have with me Dr. Russell Faust. He is our Medical Director, and he's going to help me talk to you all about our vaccine efforts, some information about the new variants that you're seeing, and also answer some common questions. So we'd like to start each of these off with just a weekly update. So what kind of vaccine numbers have we provided over the last week? And so the county has actually received a little over 16,000 doses of COVID vaccine at this time, and we've administered just over 13,000. This weekend, I'm sure you heard, we had an event where we moved our vaccine clinic indoors. Up to this point, we had really focused on drive-through locations. So we moved into this suburban showcase. It was a great event. We did just under 3,000 people at that event. So it was a great event. And Dr. Faust, you attended. Do you want to talk a little bit about what you saw at the event and what you witnessed?
I'll tell you, it was impressive. You know, because we've been providing testing at drive-through sites and multiple sites, and we've been doing the drive-through vaccination sites, the teams here are pretty, they're a well-oiled machine, and so it was very successful. There were no adverse side effects, and we were able to move through. Certainly 3,000 was not a stretch. I'm looking forward to a time when we receive more vaccine and we can be, you know, up at 5,000, 10,000 at an event like this and really get as many people vaccinated as possible. You mentioned that we've received 16,000 doses and administered somewhere around 13,000 doses. I don't want folks to think that there's doses we're not administering.
That's right.
We get 100% of these in arms. You know, the fact that there's 3,000 unaccounted for there just simply means that we have more scheduled through this week until we receive our shipment next week. So we get 100% administered. We're getting it in as many arms as possible. But we should talk about kind of who those people are.
Yeah. And another thing is a great segue. So as we have additional vaccine that we haven't given, we actually opened up 2 new sites this week that are scheduled for Friday, the West Bloomfield Fire Department on Orchard Lake Road in West Bloomfield. And also we are going to be on Sunday offering, it's kind of a special site, right? First time we've been there. It's the United Food and Commercial Workers Local 876 in Madison Heights. Now, one thing to note is all of those appointments are taken. This is not a walk-in event, so everyone must be scheduled. We do not have any same-day appointments. We're looking forward to seeing those individuals that have come off our Save the Spot list and have been prioritized to come to those events. And so we just take a few minutes and really thank our partners that have really offered up their locations and allowed us to come in to provide the vaccine at their locations. So Dr. Faust, I'm going to turn it over to you. Let's talk a little bit about the variants.
I'm going to back up just a second.
Okay.
So you mentioned the Save Your Spot.
Yes.
How do people get to that?
Yes.
Let's be very clear about, you know, how people get on the list.
Okay. Yeah. So on our Oakland County website, so the website is oaklandcountyvaccines.com. There is a link there where anyone that is interested in receiving the vaccine can go and register for us, and it puts you in a spot for the on the list, right, to receive your vaccine. And so what we do when we get additional vaccine, we go through the list. We take those priority groups, as you know, and you've heard. Right now, we're really focusing on healthcare workers, EMS. We are also working to vaccinate workers and residents in long-term care centers. Those over 65 years old. We're also working through law enforcement. Let's see, what groups did I forget?
Well, EMS, teachers, law enforcement, fire,
child care centers. And so if you're on the list and you meet those priorities, we send you a link. When you do register for Save the Spot, you do receive a confirmation so that you are aware. There is also a message on the screen once you hit submit that says you have you've confirmed or you're on the list, but you also are receiving a follow-up email. So one important thing to note is Registering multiple times, it's not like a lottery, so it's not the multiple times you register, it takes you to the top of the list. We really register that first time that you register, and we keep that on the list, and we will call you in the order that you registered.
Yeah, we use the first form that you complete to get you on the list. So registering multiple times doesn't move you up the list at all. And the other thing is, again, we receive limited amount of vaccine. People want to be vaccinated, so they should also be checking with their healthcare system, that is the hospital system, because they are receiving large quantities of vaccine, and they're actually, moving through their waiting list as well. So register with your healthcare system. Consider looking into CVS, Walgreens, and some Meijer pharmacies, but focus on the healthcare system as well.
Great. And we are excited to see the demand and the interest in the vaccine. Our lists are overwhelming, but it actually is a good sign that people are very interested in getting through the vaccine. So be patient. We will get to you. Again, we're working through the list, and we get through 100% of our vaccine every week that we receive. I mean, our goal is 90%, and we generally overpass that and are getting close to 100%. So, okay, let's move on to the variants. So I'm going to let Dr. Faust kind of talk through this. There's been a lot of coverage on this. Can you kind of talk through about vaccine effectiveness?
Absolutely. So you'll be hearing on news media and on the radio and what have you. You'll be hearing about the various variants of the SARS-CoV-2 virus. And the fact is, it's an RNA virus, so it mutates fairly rapidly, and those mutations are kind of random. Some of those improve, that is, a variant's ability to be transmitted from person to person. And there are right now globally 4 or 5 different variants. The ones that are coming to our attention are the ones that, in fact, do have an increased ability to be transmitted. That is, they're more infectious. They don't cause a more severe COVID-19 infection. They don't cause more severe disease, but they are more easily transmitted from person to person. So they kind of spread more easily around the planet. So the one you're hearing about right now is the UK variant. There's a couple others I want to talk about in just a second. The UK variant is in the United States, is in fact in Michigan right now. And again, because it's more easily transmitted, we're going to see more of it. It spreads easily, doesn't cause worse disease, but it spreads easily. So we're going to be seeing more of it. Let me talk about 2 others that are of concern that aren't here yet, but chances are they will be, and those are the Brazil variant and the South African variant. These also are transmitted more easily, so certainly we'll be seeing them. But in addition, they have slightly reduced effect by the immune system from the vaccines. The good news is the vaccines still work against all of these variants. That's the good news. The bad news is they're more easily transmitted. And so what does that mean for all of us? It means that whether you've been vaccinated or not, you need to continue to wear a mask, you need to continue to distance from those around you, and continue to avoid group associations, group meetings, especially indoors. So until we get everybody vaccinated and we can put an end to these COVID-19 infections, we need to continue these mitigation behaviors, these preventive behaviors, and we can get through this. I have to say that Michiganders have been great at doing this, in fact. We never really saw a big surge after the holidays that we expected, or that other states were seeing, other cities were seeing. So basically, I think we can all be proud of other Michiganders for doing what we need to do to put an end to this. But this is not the time to become complacent. Whether you've been vaccinated or not, you need to continue to wear a mask, continue to distance. We need to get through this, and this is really the way to do it. We're reassured with the demand for vaccine. Everybody needs to get vaccinated. So when your opportunity comes up, don't hesitate. Get vaccinated.
That's great. Thank you for that information. And so just as a reminder, if you're looking for updated information, our website is oaklandcountyvaccines.com. We're updating the website as we receive more information. If you're interested in registering for Save the Spot, there is a link available on that website, but you also can call our Nurse on Call hotline at 1-800-848-5533, and they can register you if you need some assistance there. We have nurses and other staff there ready to assist you with anything you need there. Again, we really appreciate you taking the time to listen to what's going on in Oakland County as we give updates, and we will continue to provide these updates. We look forward to providing additional information to you, and we'll talk to you soon. Thank you.